Welcome to All Things Greater Burlington, where you will hear from the movers, shakers, and changemakers that are moving Greater Burlington forward. Here is your host, Steven Brody.
Welcome to All Things Greater Burlington. Southeast Iowa Regional Medical Center, West Burlington, is among few hospitals in Iowa that have continually served patients during 3 centuries, the 1800s, 1900s, and 2000s. It opened August 1st, 1895 as Burlington Hospital, the third small hospital in a city of about 23,000 people. Burlington Medical Center began developing its future with the 1988 purchase of about 100 acres of farmland in West Burlington. The first building on the campus, now called Family Medicine Southeast Iowa Regional Medical Center, opened in 1990. After nearly 3 years of construction, the renamed Great River Medical Center opened April 4, 2000. It was the first new hospital built in Iowa in 11 years and the largest construction project to date in Des Moines County. On July 1, 2021, Great River Medical Center and Fort Madison Community Hospital became one with a new name to meet qualification for the Centers for Medicare and Medicaid Services for sole community hospital classification. The new name is Southeast Iowa Regional Medical Center. The SCH program was created to maintain access to needed health services for Medicare beneficiaries in rural communities by providing greater reimbursement. And it's a privilege today to be joined by Dr. Michael McCoy, President and CEO of Great River Health. Dr. McCoy, thanks again. I know you're a busy man, and it's just a pleasure to have you take the time to be with us today.
Hey, thank you very much.
So you have been, we were just talking off air, you have been now President and CEO for just about a year, is that right?
1 year, yeah. Prior to that, I was the Chief Medical Officer for the health system for about 8 years or so prior to that.
And what, if I might ask, what brought you to the hospital? What was it about the hospital and this area that got you interested in saying, hey, I'd love to work there? So
my wife, Tamara, and I, we were in residency together at the University of Iowa. And I finished my residency in obstetrics and gynecology. And we had talked about maybe going back to Wyoming, which is where we'd come from previously. Through Creighton and Omaha. And well, there just wasn't an opportunity there that seemed to fit for us. And so we had been used to being at Iowa City for 4 years. So we said, let's look around. Something about river towns was a little appealing to us. So, we interviewed all the way up from Dubuque and, down Clinton. And we went over to Waterloo, Cedar Falls, and down through the Quad Cities and here. And as we interviewed at different places, and really what you're doing is you're figuring out who you want to work with, I think more than anything else. And I remember Tamara and I said, let's just list 1 through 3, our top 3, and let's just see how we end up. And we both chose Burlington as number 1, so we ended up here.
Wow.
Yeah.
And was there something in particular about Burlington other than, you mentioned Rivertown, and obviously you can't beat that.
Well, I think honestly, getting right out of residency as a young physician, it's all about who you're going to work with.
Yeah.
And so there was just a group here that we both felt very comfortable that this would just be the right fit for us. I think there were some aspects of the Rivertown and how early Burlington was, settled, and the history around it being the first capital of Wisconsin territory and then the state, and some of the cool old buildings and architecture and different things. So that was very appealing, but It was honestly like, I got a second marriage here. It's who I'm going to work with most of the time. So that was probably the biggest drawing factor, honestly.
And now you're president and CEO. Tell us what does that entail? I mean, I can't imagine it's the same thing every day. You can't have a typical day doing this job.
No, there's not really a lot of typicalness in it. I think the start for me was the first few months was just trying. There's things you run into every day that you wish you knew more about than what you do.
Yeah.
But realizing once you get past even the things that you don't know, and the surprises that you don't know are out there. Now we know at least some of the stuff coming at us and how to try to anticipate it. But each day is a challenge, and there's everything from worrying about patient care and good care and quality care and taking care of the patients and families in Southeast Iowa. But then you got to worry about the staff and being the largest employer in the region and the right things to do with that. And then of course the financial responsibilities of in the trying times of hospitals today, just trying to make the finances work.
How much do you need to know personally that you bring to the table versus having to rely on quality people?
Well,
in very important roles.
Yeah, I mean, if you don't have a good team around you, good luck. But I think the biggest thing is I fortunately had the medical side and the patient care side. Just like some administrators might have more of the administrative side, not the clinical.
Yeah.
And so obviously I had more of the clinical, the administrative. So years ago, I had an opportunity to do some things for our college, American College of Obstetrics and Gynecology, and I did some things for the college at a state level and the kind of a regional level and then national. And I had a chance to do some more training and get some leadership training and kind of found out I sort of enjoyed that part of it, maybe using a part of my brain that I wasn't used to using as much. And so over time, I started doing more and more administrative things, and that just kind of morphed into slowly, gradually doing more less clinical and more administrative. But no one person's going to know all of that, so you got to surround yourself with the people that are good at the finances and good at the HR. And can do some of the operational things that you may not be as good at, and you put yourself together and you work together. Without the team, and we were sort of short on having a team about a year ago, and it was really felt good to get everybody in place then. So.
Yeah, I don't know if everybody realizes just how big you are. Southeast Iowa Regional Medical Center. You've got a lot of different locations and a lot of branches. Can you summarize that?
Yeah, so Great River Health System is the parent corporation, sort of a charitable not-for-profit. Uh-huh. Underneath that, you have Southeast Iowa Regional Medical Center, and that has two campuses, one in West Burlington and one in Fort Madison. We then have a critical access hospital, Henry County Health Center. And then we have down in Keokuk an outpatient diagnostic imaging center and a kind of a multi-specialty clinic urgent care. And so we have kind of this region. Like I said, we're the largest employer in the region. So
yeah, and I would imagine you spend most of your time on the West Burlington campus. Do you make time to go out to the other ones as well?
I do. Not as often as I like. We've even got like outlying clinics up in Mediapolis and Wapello and all the way across, Winfield and Wayland and New London and
yeah.
I don't get as much time up there as I would like to, or getting down to Keokuk. In fact, I'm scheduled, I think, to go down to Keokuk here in the near future. But between the other three campuses, between Mount Pleasant and Fort Madison here, I'm at least usually in Fort Madison once a week and usually in Henry County once a week, or never more than 2 weeks without being there.
Yeah.
So
you've got a very active recruiting department. I know Casey Fleming is always recruiting and looking for qualified talent to come here. What are some of the challenges that you see and maybe I guess that Casey has to deal with in trying to bring those qualified folks here?
I think just recruiting for healthcare is it's all about finding the right fit. And you can go into particular things like each community as housing. We've talked about housing in different aspects with the partnership, and there's groups working on that.
Yeah.
I think the biggest thing is you need to find somebody that's comfortable being in this setting. If they want to live in downtown Chicago or New York or St. Louis, they're just not going to be happy here, and they don't usually stay.
Yeah.
So it's somebody with family ties helps. Somebody that's from the region before. Somebody that wants to be here. We have a lot of physicians and advanced practice providers that say, hey, I got family in Chicago, Minneapolis, St. Louis, Des Moines. So being here is kind of central, and I don't need to live in that town. I'd like to be close by. So that is kind of appealing for us. I think the other thing is that we have our tertiary care center, Iowa City, University of Iowa Hospitals, about an hour or so away. So it's far enough away that they're good partners. They don't really come down and dip into doing work here, but they're close enough that we really rely on them a lot and refer a lot of our tertiary care patients there. So,
do you have such a thing as a sales pitch? When you're doing the recruiting, it's like, you really want to come here because.
Well, I'll borrow this from, you mentioned Casey Fleming, but it's very simplistic, and I've used this often, and I will sometimes visit with physicians, and I'll say it's really not that hard. If you come here and you want to provide access so people can see you in a timely fashion, you do a good job and you're nice, you'll be as busy as you want to be.
Yeah.
That's pretty simple.
I know obviously during the pandemic, there was its share of challenges and staffing issues occurred, and you had to deal with getting a lot of visiting personnel to come. How would you say you are coming out of that and now in terms of staffing levels? Are you at a good level right now, or would you say that there's still some room to go?
No, we're not at a good level. We're still struggling with our labor costs because of the agency staffing. We're still having to lean on is really one of the biggest financial challenges we have right now.
Yeah,
we've done a lot of things trying to look at our costs and cost management and group purchasing and all those things we've really looked at as close as we can.
Yeah,
labor cost is a big deal. We've formed our own kind of a right choice and an internal resource pool to try to help do some of that work more internally for needing that.
Yeah.
Our biggest priority, I think, is hiring our own full-time and part-time PRN staff. And then using the right choice and the internal resource pool is sort of a level of help on top of that. But it's really getting our own people back. It's just, it's very difficult for somebody that comes into your hospital and they don't know your policies and they don't know how things necessarily work from one hospital to another, and trying to do some process improvement initiatives or going in and teaching on helping the staff with something that we're trying to do differently is really difficult when you've got a revolving new people at a much higher cost than what our own would be. So, I think hospitals around the country are starting to see a turn that way. We are, but not as fast as we would like to.
Yeah.
And I think that's what the real financial struggle is that a lot of hospitals, and not just the state but the nation, are feeling is that.
And I think you're right on that, because obviously being a doctor and a nurse is a very noble profession, and you want to be able to get the best and the brightest to come here. But there is obviously those factors. You've got inflation that's playing into it and cost of living, and so it can be a challenge in trying to attract those folks to come here and want to stay here under those circumstances.
Yeah, and the cost of living here is great compared to some other places, a lot of other places. But in the healthcare world, unlike a lot of others, when there's the inflation and sometimes then those costs are passed on to the consumers, we get reimbursed what we get reimbursed. It doesn't matter what we charge; we're going to get paid what we get paid, and the reimbursement just hasn't kept up with the inflation of what the costs are for us. And that's why hospitals are really struggling, because that just hasn't happened. And it's a big deal to shut off a service line and say, we're not going to offer this anymore, or try to limit your hours. So those are tough choices. And so we're really working through that.
Yeah. Well, and you've also got a good partnership with SCC, with Southeastern Community College on the nursing side, correct?
Yeah, we've got a great partnership with SCC and Dr. Ash and his team. And we've got a grant program there with the nursing. And we're just getting, I think we'll really hopefully start to see the big benefits of that, of getting more people in and getting more people in our health system from a nursing standpoint, especially by next spring. And then we're also having some discussions of how we can sort of help students, not just in nursing, but in some other aspects of thing. We're starting a Rad Tech program, a brand new program at Southeastern Community College, and we're starting that. The first class will be about a year from now, next fall, actually. And I think, according to Dr. Ash, I think that class is already about full of applicants. So
that's great.
And then we're also looking at just ways, not in as a biggest way, because numbers wise, because nursing is really the biggest challenge, but some of the other things, some medical assistants or maybe EMTs or respiratory therapists. There's a variety of things that we need to hire in our region and our health system that SCC can be partners with us on. So we're having those discussions also.
And if you just answered this question, forgive me. Is there a certain area that you are in more need?
Nursing.
In nursing.
Yeah.
Okay.
Nursing, but and nursing, CNAs, nursing assistants, and techs, variety of technicians, diagnostic imaging and ultrasound and respiratory therapists. And I think the thing that came really clear to everybody in the hospital and the healthcare teams is how intricate and vital it is to have everybody in the team be there. And when you have a missing link there of any one of those folks that I just mentioned, how much it can affect everyone else and how efficient they are and how much work they can do and the level of care we can give patients. And I think the hardest thing during the COVID pandemic was it was really at times hard, and it still is a little bit, because we just don't have a lot of flexibility when somebody's gone or sick. We sometimes don't have a lot of flexibility in helping flex up to staffing when needed. But continuing to provide the level of care that patients and families that they deserve and are expecting.
Yeah.
And trying to continue to provide that sometimes with the staffing struggles has been a real challenge. And we're really trying to focus on the patient experience. We're trying to look at the quality of the care we're giving and paying particular attention to that. And then really trying to focus on investing in our own people. Where there's a variety of things we're trying to do right now because our people are our biggest asset. And without everyone I just mentioned and all the non-clinical, I can't go on and on and on, but then you just can't give the right care and you don't have the team in place. So we're really trying to focus on investing in our people right now too.
If you could describe your leadership style, what do you think that would be?
Yeah, that's a good question. I'd probably have to have you bring in some folks that work with me and ask them. I think some of the real skills that leaders need is being able to get collaboration and teamwork out of folks. I think trying to communicate well. What leaders communicate is interpreted by the staff totally differently if that's not communicated well, but trying to be transparent. Yeah. I think so communication is huge. And then I think sometimes the sort of biggest thing, maybe the emotional stability or maturity or whatever, I think, to be able to listen, be able to accept the ideas of others around you that may not be like yours, be able to try to adapt, and look at how sometimes the emotions of other people around you may not be different than the emotions you're having in certain situations, and be able to see that and adapt. I think that those are probably some of the biggest things I think that can be important. And so for me, the thing I've always tried to focus on is trying to be very pragmatic and trying to look at all sides of issues, get everyone's opinion as much as possible, and try to hopefully build kind of a collaboration around things. But as we all know, that works well most of the time, and sometimes it doesn't. And then you just have to do what you have to do. So.
Right. Well, thank you for answering that. Now would be a great time. Is there something like that you want to toot your horn about the hospital? Because obviously there are hospitals that will be recognized for excellence in different areas. Has that happened recently?
It's been so hard coming through the pandemic, and then there were so many things we kept talking about. Well, this was started, or this was ongoing, and then COVID hit, and then everything stopped. So we've really been trying to rebuild. What are some of the things that we were doing, or starting to do, or thinking of doing that got shut down by COVID? And we're like, listen, we can't just do this forever. We got to move on, and trying to do it in a way that doesn't completely overwhelm our already overworked staff. But we have very dedicated folks. And really, if it's things related to trying to give good patient care and having patient experiences, those are easy things for our staff to want to get behind.
Yeah.
We're doing some things now to try to get a cancer care accreditation with University of Iowa, and that is that process is ongoing. We've contracted with the largest company in the United States around quality of healthcare, and we have had them come in and do a complete assessment of our quality program. And now we're trying to work on some of the things that they've seen that, okay, here's the top 5 things that you should work on for your hospital. Yeah. And so we're really trying to focus on the care we're given and the quality of care and patient experience. Because as we've, and I've said to some of our leadership, when you get all of our leaders at the whole region together, you have about 125 people. And if we can't have our hospitals be places where people want to work and patients and their families want to come for care, then all of this work we're doing is just for naught.
Yeah.
So really that's what we have to focus on, and trying to think of the care we're given, the patient experience, and then investing in supporting our own people. So that's really what the focus is now.
Yeah.
There's certainly some things we're doing in different departments as far as, a stroke certification and some of those things that we find important, but most of those things are related to patient care and trying to think about the right thing to do. So
there definitely seems as well, Doctor, a desire for folks where you are to get connected into the community in leadership positions as well. I mean, we've been fortunate with at the Greater Burlington Partnership that we have had folks from the hospital be involved in the partnership and divisions and different things like that. Is that something that's intentional that you try to impress upon folks?
Well, I think we've always had here at the health center, I think participation, but I think maybe it was COVID, maybe it was everybody kind of getting drained a little bit with everything going on around healthcare and the pandemic. But about a year ago when I started this, that was one of the things, one of the very first leadership meetings, we got everybody together. And I said, one of the expectations is that you get involved in something in your community, something that you're not already involved in. It doesn't have to be something you're spending multiple hours a week doing, but you just got to have involvement. And we share sometimes about every quarter or so, we'll bring up what's something you're involved in now that you weren't before. I've shared some of those things for myself. And I couldn't off the top of my head quote you, but at about 3 months or so ago, I shared with the group, because we've kept track of that, the number of things that now we have folks in part of our leadership. And I said it's an expectation. I expect you to get involved in something, but I would encourage the staff below you to get encouraged also. Yeah. And so we've shared that as far as the number of things, meetings, boards, presentations. We don't keep track of hours of service so much. That's a little hard to do with a group our size. But it's really been amazing how much people have gotten involved in things in our whole region.
Yeah. In your role, does your job end at a given part during the day, or are you on 24-hour call?
Yeah, well, call for me is different than it used to be. But no, there's several of us on the executive team, and we have kind of a secure messaging system. We call it Halo. It's just the name of it. But for most of us, that's always on. And so if somebody's get a hold of any of us anywhere, I've gotten Halo texts when I was in the middle of a boat fishing in a lake in Canada before, when I didn't even think there was cell service, but I found out there was. But no, I don't get called as often at night late, like you used to with clinical care. But it happens, and usually when it does, you're trying to help clinicians with an issue that's going on around. I can't get a patient treated right or in the right place, and there's not beds, or you're trying to work out something with some sort of staffing, or it's usually patient care related. But I got a really good team, and most of us, especially those with clinical care that are part of the clinical care leadership, we're available usually all the time.
What's the extent of care that can be done here in terms of, I guess, trauma care? Can you pretty much do everything here, or are there certain things where you can't in West Burlington and they have to be transported somewhere else? Yeah.
So the two specialties we don't have here is we don't have structural heart, meaning open heart, but we do a lot of things interventionally. Amazing what they can do now that interventionally. And we don't have a neurosurgeon.
Okay.
But we have an orthopedic spine surgeon. There are some, so those are really the only two specialties. There are some areas of trauma, so different trauma designations around the state. And we have general surgery, and we have orthopedics. But there are certain things that may require sort of tertiary type care. There are some total fractures or multiple fractures that would be hard for us to treat here. For instance, if there's a concern over something happening, it could require blood utilization beyond our capacity. There's occasionally those things come up in certain OB things. So there's one-off things that can come up in a lot of our specialties.
Yeah.
But for the majority of the things in all the other specialties, those are the things that we try to do here. What we really try to do is keep people as close to home as possible for their care. Yeah. And that's at any of our hospitals. If they're at Fort Madison or Mount Pleasant, we want to have a reason why. Can we keep them at that hospital? If not, can we have them at this hospital? Because there's a little more specialty care. And if not, then transfer them to where the tertiary care can be. So that's the key, is keeping people as close to home as we can.
Is Iowa City the next place to send folks to?
That's where most of our tertiary care goes. After the pandemic, there's been a lot of places where just bed availability, a lot of hospitals or the university, they're full about every day, just like a lot of times we're full about every day. And we're boarding people in our emergency departments now. We didn't do that before. And the reason is because we're waiting for the next day when beds open up and we can get them somewhere. So primarily Iowa City, but sometimes if Iowa City's full and it's going to take too long, we will search other venues. We've sent patients to Peoria. We've sent patients to Des Moines. We've sent patients all over, but 90% of our tertiary care probably goes to Iowa City.
And you utilize life flights?
Oh, those? Yeah. A Medforce, we utilize actually quite often. So
yeah.
And they're going to be building a second hangar sort of on the campus, so they always have a second helicopter available. That way, if there's ever any sort of a concern related to a malfunction or equipment malfunction or something, that we never go without service. We always got another helicopter as a backup. So.
Yeah. So what do you like to do in your downtime, when you actually get downtime?
We've got kids now in North Carolina and Wyoming and up in Minneapolis, Minnetonka area. So when there's a little free time, I try to catch up to my wife, who, when she has free time, she's usually visiting them, and I try to catch her or follow up. We like to travel. I like to play golf, but I don't play enough of it that I get very good at it, but I sure like it. And so those are the biggest things that I enjoy. And then we sort of have a home that doesn't really have a lawn. It's just sort of a big perennial garden around our house. So I go out there and I goof around in that enough just to give me something to do. So
great. Well, we're just about out of time, but I want to thank you again for coming here and talking with us and sharing what's going on. It's obviously a very important role that you play here in the community, and that you invest in the community, and that you have folks with the medical group that are involved in different organizations. So we really appreciate that, and I just want to continue to come beside you and wish you continued success.
Well, thank you. I think I've really, seems like we've starting to get more and more of people speaking about having support in the community and supporting us and us wanting to support them. And we're trying to have our marketing be more also community relations. And, what we really just need is to help the region and the community know what we do and where we do it, and that we're going to try to do it well. And if there's things we're not, or there's gaps, let us know so we can let you know how we can either fix it or address it as best we can. So.
Perfect. Well, Dr. McCoy, thank you for being with us today.
Absolutely. Thank you.
We thank you very much for listening. Don't forget to like and subscribe wherever you're listening to All Things Greater Burlington, and give us a call at the Greater Burlington Partnership if you have any suggestions on who you'd like to hear on a future broadcast. Until then, have a great day. We'll see you next time on All Things Greater Burlington.
Have been listening to All Things Greater Burlington with Steven Brody. Be sure to hit the subscribe button to catch all new episodes. To learn more about All Things Greater Burlington, visit greaterburlington.com/ATGB.